Good morning, I am Dr. Maciej Iancu Potrubacz, and it is a pleasure to share with you this case of lower molar extraction with destructive caries that was presented to our attention. The difficulty in extracting a fully erupted mature third molar, as in this case, lies mainly in the shape of the roots. Extraction can be quite straightforward when the roots are fused, the so-called peg-shaped root. However, when there are two independent roots, the difficulty increases, especially if the roots have a curved anatomy with very thin apices. In these situations, it is often necessary to perform a significant syndesmotomy and sometimes to separate the tooth, extracting each root independently. The availability of tips mounted on the mallet, especially the new Blexo Mini and Slim tips, allows us to avoid performing syndesmotomy with other devices. The new Blexo tips have allowed us to work directly on the dental element without having to use osteotomic tips. In sequence, the Blexo micro tips were used, starting with the initial tip, which you can clearly see acting inside the groove of the dental element in order to begin the very first mobilization. Next, the Slim tip is utilized. The Slim tip possesses a somewhat greater thickness compared to the previous tip, but it is still not yet considered a tip that is suitable for all situations or uses, achieving the mobilization of the tooth. As for the first two tips, these allowed us to achieve an initial mobilization of the dental element so that we could then use a standard straight elevator, not mounted on a mallet. After initially mobilizing the dental element with the standard elevator, we then proceeded to use the mallet tips again, specifically the Slim tip, which allowed us to work safely and precisely even from the lingual side of the tooth. This is something that is not normally possible in the lower arch when using standard extraction elevators due to the limited access and visibility in that particular area. By carefully alternating the use of the two tips for mobilizing the dental element and a traditional elevator, we gradually reached the point of complete mobilization and extraction of the dental element with a standard forceps for lower molars. As you can see, the anatomy of the dental element is not simple. No root fractures were recorded with the use of the mallet alternated with standard elevators. And as you can see from the video and the photograph, the extraction site is remarkably clean thanks to the use of these techniques. Thank you for your attention, and I hope you found this case interesting.